Welcome. Today we're diving deep into autoimmune gastritis, a condition where the body's own immune system mistakenly attacks the stomach lining. We'll explore its causes, how it develops, who's affected, and what can be done about it. Join us as we unravel the complexities of this fascinating and important disease. So, what causes autoimmune gastritis? At its core, it's a breakdown in immune system tolerance. Normally, our immune system distinguishes between self and non-self, attacking foreign invaders like bacteria and viruses. In autoimmune gastritis, this system malfunctions, identifying parietal cells, cells in the stomach lining responsible for producing stomach acid and intrinsic factor, as foreign. Genetic predisposition plays a significant role. Individuals with a family history of autoimmune diseases like Hashimoto's thyroiditis or type 1 diabetes are at higher risk. Environmental factors, although less well-defined, may also contribute to triggering the autoimmune response in susceptible individuals. Let's break down the pathophysiology. The misguided immune attack primarily targets parietal cells. This leads to chronic inflammation and progressive destruction of the gastric mucosa, that's the stomach lining. As parietal cells are lost, stomach acid production, known as hydrochloric acid, decreases. This is called hypochlorhydria or, in severe cases, achlorhydria. Crucially, the destruction of parietal cells also impacts the production of intrinsic factor. Intrinsic factor is vital for absorbing vitamin B12 in the small intestine. Without it, vitamin B12 deficiency develops, leading to pernicious anemia. Over time, chronic inflammation and damage can lead to metaplasia, where the stomach lining changes its cell type, and even an increased risk of gastric cancer in rare cases. Autoimmune gastritis affects an estimated 2% of the general population, but its prevalence is likely underestimated due to its often subtle and slow, progressing symptoms. It's more common in women than men, and typically diagnosed in middle age or later. While it can occur in individuals of any ethnicity, it's more prevalent in people of Northern European descent. The disease often clusters within families, reflecting the genetic component we discussed earlier. Co-occurrence with other autoimmune disorders like Hashimoto's thyroiditis, type 1 diabetes, and vitiligo is frequently observed, further highlighting the interconnectedness of autoimmune diseases. The symptoms of autoimmune gastritis can be quite varied and often develop gradually. Initially, many individuals experience no symptoms at all. As the disease progresses, symptoms may include fatigue, weakness, and shortness of breath, common signs of anemia due to vitamin B12 deficiency. Digestive symptoms can include nausea, abdominal discomfort or pain, loss of appetite, and weight loss. Neurological symptoms like numbness or tingling in the hands and feet, difficulty with balance, and cognitive impairment can also arise from long-term vitamin B12 deficiency. In some cases, individuals may develop glossitis, an inflammation of the tongue, making it red and painful. Diagnosing autoimmune gastritis typically involves a combination of tests. Blood tests are used to detect antibodies against parietal cells and intrinsic factor. Low vitamin B12 levels and elevated levels of gastrin, a hormone that stimulates acid production, are also suggestive of the condition. The gold standard for diagnosis is an upper endoscopy with biopsy. During endoscopy, a small camera is inserted into the stomach to visually examine the lining. Biopsies, small tissue samples, are taken and examined under a microscope to assess for inflammation, parietal cell loss, and other characteristic changes. Histological examination of the biopsies can confirm the diagnosis and rule out other potential causes of gastritis. Autoimmune gastritis doesn't have subtypes in the same way that other autoimmune diseases might, but it's important to understand its progression and potential complications. We can think of it in terms of stages. Early stages might show only mild inflammation with antibody presence. Later stages are marked by significant parietal cell loss, anemia, and potentially metaplasia. The key is to identify the disease early to prevent the more serious consequences of long-term B12 deficiency and reduce the risk of gastric cancer. While there's no cure for autoimmune gastritis, treatment focuses on managing symptoms and preventing complications. Vitamin B12 supplementation is the cornerstone of treatment, usually administered via intramuscular injections or high-dose oral supplements to bypass the impaired absorption in the gut. Monitoring for other vitamin and mineral deficiencies, such as iron, is also important. Regular endoscopic surveillance may be recommended to monitor for the development of metaplasia or dysplasia, which are precancerous changes. In some cases, medications to suppress the immune system, such as corticosteroids or other immunosuppressants, may be considered to reduce inflammation, though this is not a common approach due to potential side effects. Dietary modifications, such as eating smaller, more frequent meals and avoiding foods that irritate the stomach lining, can also help manage symptoms. Unfortunately, there is no definitive way to prevent autoimmune gastritis, given its genetic component and unclear environmental triggers. However, maintaining a healthy lifestyle, including a balanced diet rich in vitamins and minerals, may support overall immune function. Early detection and treatment of other autoimmune conditions may potentially mitigate the risk or severity of autoimmune gastritis. Being aware of the symptoms and seeking medical attention if you experience any concerning signs is crucial for early diagnosis and management. The prognosis for autoimmune gastritis is generally good with appropriate treatment. Vitamin B12 supplementation effectively prevents the complications of pernicious anemia. Regular monitoring for gastric cancer is essential, as the risk is slightly increased. Recent research is focusing on identifying specific genes and environmental factors that contribute to the development of autoimmune gastritis. Researchers are also exploring novel therapies to modulate the immune system and prevent the destruction of parietal cells. Furthermore, advancements in endoscopic techniques are improving the early detection of precancerous changes in the stomach lining. These ongoing research efforts hold promise for improved diagnosis, treatment, and prevention of autoimmune gastritis in the future.